Here's our tubes that we just spun. We're going to start making biofiller first. So this takes us 10 minutes to heat up. I always do it first just so it's ready to go when we're ready to inject. What I look for that makes it easier for me is tubes that are filled the highest. So we always say don't worry about, you know, filling it to a certain point, but it just makes it a little bit easier. So if you can see these two right here, let me turn all of them. These two right here are going to be the highest. So we'll pull these two. The reason for that is because this needle is only so long, so I have to go all the way through this top to get down to draw up 2 cc's of this. Okay, so we're going to go right through the top. This is going to be for our albumin gel, which is going to go in the heater. So we're going to drop all the way to 2 cc's. I like to hold the tube and the syringe in one hand, grip it like that, and then pull the plunger with my other hand. The reason why is if I let this go and I'm trying to do it with, you know, whichever way, it's really hard to keep this from just going all over the place. So we'll start drawing up. And then you can see the bubbles. So what I'm going to do is tilt sideways. So now we'll recap it.
And you spun that on 700
for 8 minutes. Yep. Okay. For fillers, we want all the bubbles out. So pay attention to here at the bottom too, because you'll get some there. And then we're going to push this up to 2. Okay, this needle comes off. And then we have blue little caps like Marvin showed you yesterday for the bioheat. So we'll take one of these and place it on. Okay, and this is going to go in the middle row. And then we'll do the next one. So again, right through the top. Go towards the back wall, it just makes it a little bit easier. This is my angle here, holding it with one hand and pulling the plunger with the other. Yeah, yep. So the top layer has the most clotting factors, which is going to make a really good albumin gel. So that's what I'm going for right now. Okay, so if this happens, actually, I'll show you a trick where you can get more. Okay, so we're going to go back into this. I only got 1.5. We could fix our ratios when we make it. It's always like 2 albumin gel to 1 liquid, but I'll show you how I can just drop a little bit more. This you have to be really careful. If you're going back in the tube, there's still going to be a vacuum, okay? So as soon as I go in, it's going to pull this down. The way to stop that or prevent that from happening, I'm going to grip the plunger tightly, go back in. I'm still holding it. I'm just going to really curve it and then continue to draw.
Can you just pull the cap off that one since you're just drawing off all the...
So, I mean, no, because you don't want to get down to your Buffy coat. I'm sorry, who asked
What
that?
I'm saying though, if you pull off the cap, you would have easier access to get that last cc or so.
Right. I don't want that yet though.
Okay.
I don't want that. So I'm heating up my albumin gel, right? The top layers are your fibrinogen and thrombin. That's what I want. That's going to help
No,
clot
I
it.
understand, but what I'm saying is since you're drawing up basically that PPP layer.
Look.
Right, you're not going to use that when you went back in. What I'm saying is in that case where you were going to go back in.
I'm going to use this though.
Oh, are you?
Yes.
Got it.
Yeah. You'll see. I'll show you.
Okay.
Okay. I don't think I'm going to get 2 here, but. Okay, so we'll just fix our ratios then. All right, same thing in the middle row. So these two that we just drew from are gonna go right in the biocool because after we're done heating these, we're gonna go back in and actually take the buffy coat and then mix it with our gel, okay? So those will go in the biocool. Okay. Now the rest of the four, we're going to use these for 2 for microneedling, 2 for liquid papule injections. So all these, we're going to pop the top and then go down the buffy coat, okay? I usually go, like draw around 2 cc's of each. So you're going right above the red. Remember, we don't want to pull any red for this at all. Okay? So we're just drawing, and we got to 2. Same for the next one. Okay. All right, and then the last one.
So you're going up how many cc's?
Around 2 cc's. Past that is you're getting kind of to that PPP layer, so I don't really go past 2. If you need more, it's good to keep these in the cooler, just in case, like say you run out and you need a little bit extra for microneedling or you want to inject more, you can draw from it, but, all right, so these will come off, and then I'll get these ready for Dr. Davies to do papule injections. So we're going to attach a 30 gauge needle to these. And then these 2 here, we'll just take the needles off. These will be for microneedling, so we'll just apply it with the syringe for microneedling, okay?
Do you have a time frame for this part? Are you kind of on a time crunch for this part?
Yeah, because if I leave these sitting here for too long, they're gonna clot. I probably have like 5 to 10 minutes for that, but she'll inject and I'll go right away. And then these, I didn't mention actually, these will sit here for 10 minutes. When I'm finished with that, the 10-minute timer goes up, they'll go in the cooler to cool down before I mix them, okay?
Just for sequencing, the reason I'm doing these injections first before Lauren's going to show you the microneedling is because of that question about the time limit. I'm using such a tiny needle, so it's this 30 gauge 4mm needle. That's what I'm doing my papules with. And so I want to get those done first because I've got a bit more leeway with microneedling. Okay, so Lauren's really moves them nicely. Anytime you need to remove bubbles, and especially with a biofiller, I actually like to pull down, and Lauren's actually removed them beautifully, so they're not here. But if I'm using Botox and I don't want to waste any drop, don't flick when it's at the top. Pull it down, flick, get rid of all the bubbles, and then prime it, so it's at the top. Especially because we're in a hotel room with carpet, so we don't want to be spraying PRF everywhere. Okay. So our patient has had quite a lot done today, but I'm going to show you now the papules. Then Lauren's going to do the microneedling, and then finally we're going to do the beautification point of the cheeks once we have the biofiller. So do a big smile for me. Okay. So we start, like I said, you don't want to start right at the eye because they're going to get a fright. So we start at the furthermost point, and I'm wanting to actually inject into the line. So my needle is primed. I put my bevels up, I can see. I haven't injected anything. I'm checking where I am. So So that would be my papule. Thank you. Thank you so much. So that's actually a good tip because if it leaks and it runs into the eye, ophthalmologists make eye drops for dry eye with PRF. So it's not painful, they just panic. So that's one thing I tell them. It's good for your eye, blink it away. So that just reminded me of that. So here we go. There's my papule. And about half a centimeter long. I'm actually in the line. I check where I am first. And there's my papule. And I can actually right up close to the eye. There's my papule. So something like Botox. The back is up. With something like Botox, you never go above the orbital rim. But you can do it with. Yes, so I just want to show you a little one here. My bevel's up. Thank you. So, with something like Botox, we don't want to go right up under the eye because it causes drooping. But we can get these tiny fine lines with this. And just remember, you've got to be able to see if your bevel's up. So my bevel's up, and I can get in right under the eye into this fine line. And there's my papule. So I want you all to practice papules tomorrow, working from the outside in. And just to show you a very nice place to also do papules are along these necklines. And ladies, it almost looks like a pearl size when you do a papule here. These ones you can go about 1 centimeter apart because they spread. And you just go all along the lines. So tomorrow you're all going to do some crow's feet and some necklines. Okay. Just in the interest of time, I'm going to be quite quick on the other side before everything clots. And these papules, they stay up as little bumps sometimes, but by the time the patient's going home, they're pretty much gone. I usually use about 2 needles per side. If you're doing a lot of papules, it does start to get blunt and the patient will start to complain more about pain. And if they don't have lines at rest, just ask them to squint. So just, yeah, that's good. Just so I can find my line. Make sure my bevel's up, that's perfect. Okay, my patient's been through a lot today. I'm going to do these ones right under the eye, just like that.
How long does the anesthetic last?
I don't think it's lasted to now. I don't think it's helping at all right now. Yeah. Oh, more. So then so it is actually still working because she's feeling it more on the neck where we didn't put it. So just so that we don't have a one-sided result, I'm going to do the pearls on this side. Okay. Great. So now I'm happy because I've got the liquid through this tiny little needle, and I'm going to hand over to Lauren again for the microneedling.
microneedling device for tomorrow, okay? A lot of people have issues with putting the tip in the actual device, so we'll just go over it real quick. So, I don't know if you can see it on the camera, but so you have your arrow here, okay? Every time you put in a tip, it's gonna go in that arrow at 0, and every time you take it out, it has to come out at 0. Another thing to look at too is actually inside you have a small slot and then a bigger slot, okay? Same thing on the actual tip, you probably can't see that. That's why it has to go in and come out at 0, all right? If you're noticing your pen isn't calibrated correctly, it's because there's a little, I don't know what you would call it, but this thing can get spun down. Say you take it out at 1.5 instead of 0, it's gonna be further down, and then when you turn it on, it's gonna be at like 2.5, if that makes sense. Okay, so super important to do that. When you put it in, you're gonna push down and turn all at the same time, okay? Same pressure, just push down, you hear the click, and then turn, okay? And now you can go to different depths. You have a protective sleeve here. So this just slides right over. Okay, and then another way to check the calibration too is you can actually turn this on. This is going to be hard to see on the camera, but you guys can do this tomorrow. Turn on your pen, start at 0, and if you turn your tip all the way up to 2.5, you can actually see the needles come out, okay? They just get higher and higher. On the pen, the settings. So we have depth, which we're reading from the tip, and then speed is the actual machine. It's good to start around 3, okay? You guys, like when you start speeding up, you want to go to 4 or 5, just because you'll notice you'll start dragging. This is just telling you how fast your needles are actually coming out of your pen, okay? All right, I'm going to sit you back up. Sit up real quick. Just so you don't fall back. Alright, so we will start. You guys are going to have sheets tomorrow that read depths, but typically what we do is cheeks will do 1 to 1.5 on both sides, obviously. Forehead is 0.25 to 0.5, same as the nose, the upper lip, and the chin. The neck is going to be 1 to 1.5. Remember, everywhere we injected the papules and took off the spots, so here and over here, we have to microneedle at a depth of 2. Okay, super important to remember. So we will start. I always start on the cheeks, so I'm going to have you turn your head.
Can you repeat what you just said about where you how deep you go on those?
So anywhere you injected papules, the liquid PRF papules, or removed a spot or age spot, whatever, microneedle at a depth of 2. Okay, you can stamp or you can circle. Okay? Are you ready? So we'll change our depth first. We'll try 1.5 on her. Usually, when we're doing these, the numbing kind of starts wearing off, so she might be a little bit sensitive, so we could go down, but we'll try it. Okay, ready? So we're going to apply it all over just one section. Okay, and then we'll turn it on. Our first pass, we're going to start over by the ear, and we're going to come up. How is that, okay? Okay, awesome. All right, so first pass is going up. When I go around the eye, I just lift up my pressure just a little bit. It's really bony right there, so it can get pretty sensitive in that area. And then our second pass, we're going out towards the ear. Our third pass, we're gonna do diagonal. Every pass, just think of going up and outward, like lifting and pushing out, pretty much. Okay, so that's one cheek done, so we'll turn. And then apply on this side. start at the ear and go up. A lot of people ask too, like how much pressure do you put? You'll feel the weight of the pen tomorrow. You don't really have to push down at all. I just let the weight of the pen kind of be the pressure that I use. When you switch sides or, cheeks, whatever, a lot of people will change their pressure at that point and kind of start digging in more, so just watch that. And then, especially when you're on the forehead, I'm actually going to turn this down a little bit. So we'll go to 0.5. When you get to the forehead, it's really important to follow the curve of the face. If you're going straight and you're not really curving it with the face, you're going to dig the end side of your needles into their skin a lot deeper, and it's going to hurt a little bit. Okay, so we split the forehead in half. First pass, we're going up. How you doing, okay? Okay. And then we'll go out. And then diagonal, always going up. Okay, and I just meet myself where I stopped right here. So then we'll do the other half. The reason I don't apply all the PRF to the whole forehead is because by the time I get through all 3 of my passes, it'll just dry out and then I'm kind of wasting it. So just keep that in mind. Okay, so we're going to go up again. And then we'll go out. And diagonal. If you notice you're dragging, it could be 2 things. One, you're either going too slow or too fast for the speed you have it on the pen, or you just need to apply more PRF because it's just too dry. Okay? Let's go to the nose. I'm just going to turn it down a little bit, right above 0.25. Put your chin down a little bit if you can. Yeah, thank you. So the nose is typically 1 pass. When you do the nose and the upper lip, you always want to go downwards because it's easy to catch the top of the lip or the top of the nose, and that's also painful. So we'll go down. How is that? Okay, and then down this way. We always get in this little crease right here. We get a lot of buildup in that area, so this helps kind of break it down. Okay, and then we'll do the other side. Sorry, I couldn't hear what you said.
How close to the eyes can you go?
Do you see where my redness is? Like right here?
Okay.
You can feel the bone too. I usually just stay on the bone and don't go above that. You okay? All right, so again, half the lip. Yeah, do that. Yep. So we're gonna go down for the lip and then outwards. And then we're going to do our diagonals as well, but I'm still going to go down for this, just so I don't catch. And then we'll do the other side. So down, starting in the middle. Sorry. Out. And then downwards diagonal. Go back up to 0.5. Tomorrow when you're changing depths, either turn off your machine before you do it or always hold it down. If you're changing it and holding it up in the air, you're just going to spray PRF everywhere. So just keep that in mind. Okay, so split the chin in half again. So we're going to go up. Out. And diagonal. Okay. How's the pain? No? Good. Okay, so before we move on, we're gonna go to 2. I'm just gonna do little stamps over where I was talking about the injections and the spots we removed. So I'm just gonna turn this up. I don't recommend doing this first because then it is pretty sensitive, and if you do it first, your patient's gonna be like, ow, and then they get all anxious and they don't like the rest of the treatment. So for this spot removal, I'm just gonna stamp. How are you doing? Okay, you're tough. And then we'll put some more over where we did the papules and stamp again. So me stamping is just breaking up these little pools where Dr. Davies put some papules in. Okay, we'll do the other side. And then while I'm at this, oh, I forgot right here too. Okay, and while I'm at this step, we'll just go down to her neck and we'll just stamp over these. Is that okay? Okay. All right, and then we'll do her neck at 1, and then we're all finished. Okay, same thing, split it in half. First pass, we're gonna go up. Is that okay? Okay. Make sure when you're doing your passes too, you don't forget under the chin. It's a really easy place to forget just because you can't really see it, but keep that in mind. Second pass, we're gonna go outwards. Okay, and then we're gonna do diagonal. Yep, we got it. All right, turn your neck. And I don't know if you guys noticed, when I apply the PRF, I actually use a syringe. So I'm using my hand to kind of push it out and then using the top or side of it to apply it around the area. It's a lot easier than like turning off your pen, going back, picking up your syringe. So try this tomorrow for sure. It's just a little bit more efficient way of doing this. Still doing okay? Okay. All right, we'll go out. Okay, and then we'll do diagonal. Really? Our numbing's really good. All right, and that's it. So you can look at her face too. I just want to point this out. This happens to a lot of patients. See how she's like red in some areas and then it's not really red? It's just how their skin reacts. Some people, I'll microneedle and do a whole treatment and their skin looks like they walked in, like what it looked like when they walked in. It's just a delayed response. So later, I'm gonna tell her she's gonna be red. So don't let it scare you, okay? All right, so we'll go do the biofiller quickly and then you can